Okay. So far we have seen what you mean by FTT, so what you mean by Phakka Roga, and what is the definition, what exactly we have to take. This is nothing but a clinical condition, this is not a disease. The explanation given with regard to the FTT is almost the same when you consider the explanation given for the Phakka. Okay, now, so what contemporary science says this, there are some nutritional causes, feeding issues, okay, artificial milk feeding, improper way of feeding, okay, there are some mechanical and structural problems related to feeding. All such condition or caloric value of the feed, they are all one of the cause for the development of a FTT, isn't it? If the child is given with the diluted milk, definitely child will going to develop FTT. If the breast milk was not given properly up to 6 months, again, or if the supplementary food is not started in proper time, child will going to develop a FTT. Clear? Such explanations are also given in Ayurveda under the heading of Phakka Roga, where when I explain Kshira Phakka. In the Kshira Phakka, as the name suggests, Kshira itself is the problem. That Kshira may be less, that Kshira may be abnormal, that Kshira may be over diluted, or that Kshira may be under diluted, or there may be some intolerance to this Kshira, okay, like cow's milk allergy or cow's milk intolerance, etc., or some other allergy related to the proteins which is present in the animal milk. Okay, so that may also lead to the same problem, but that has been explained under the heading of Kshira Phakka. Okay, so what is explained in Ayurveda and Kshira Phakka? If the child is consuming the Dushtasthanya, the breast milk which is vitiated by different doshas, it may lead to the problem. Ultimately, it leads to Phakka Roga. Second, top feed related. Some of the problems related to top feed. Okay, because they say Kshira Phakka is because of Kshira. Okay, one is vitiated Kshira or normal abnormal Kshira, or calorie wise less Kshira. Okay, only carbohydrate rich Kshira. Okay, or over fat content Kshira. Many things are there. So when I say Kafaja Stanya Dushti, the breast milk quality will go into differ here. The breast milk contains more abnormal fat substances rather than the proteins. So when I talk of Vataja Kshira, there will be less caloric output. Okay, when I Pitta Kshira, so again definitely so many infectious factors are there, or immunological property of the Kshira is less. Like that we can differentiate, that we will see in the next classes. So this is when he says Kshira Phakka. The feeding problems as mentioned in the contemporary science leading to FTT, here also the different things which are explained in the Kshira Phakka, so that leads to the same. Okay, newborn and the infantile period. So this Kshira Phakka is more common in the newborn and infantile period because Kshira is the main diet in the newborn and as well as infantile period. Later on, 2 years onwards, the incidence of Kshira Phakka decreases. Okay, by that time, if you are not able to take proper care regarding Kshira, definitely baby will develop the FTT or Phakka Roga. Okay, but suppose a disease starting after 2 years, it is less likely to be a Kshira Phakka. It may be because of some other factors that we will see. So this is one thing which is explained in our science. Second is Garbhaja Phakka. Okay, now what are the things that which is explained in the contemporary science you include under the Garbhaja Phakka? Now Garbhaja Phakka, Kashyapa very clearly says, Kashyapa very clearly says, he says that Garbhini Matrika Stanyasya Vinivartanat. That means the idea is very clear. Suppose a mother is there who has a lactating baby. That means she is lactating period. He is in the lactating period and the child is taking the breast milk. In the meantime, if the mother pregnant again, then what happens? Naturally, the first baby which is now feeding, that will be get affected. It's quite simple. Pregnancy, hormones related to the pregnancy and hormones related to the lactation, so they are quite opposite. Both cannot exist together. Okay, now what happens? Mother is already feeding the Garbhini Matrika Stanyasya Vinivartanat. Okay, that means already a lactating mother, if she is pregnant again, then the first child Garbha Pidita, the first child will going to suffer very badly. The first child will going to get less nutrition because breast milk is not available. Second is the first child also emotionally deprived. Now again, this particular condition of Garbhaja Phakka, it correlates with the problems related to FTT, problems leading to FTT because of poor spacing of the child. poor spacing of the child. We say usually 2 years of gap should be there between two kids. Okay, but here, so within 1 year itself, when she is lactating itself, she is again pregnant. Okay, that's the issue. So poor spacing, such issues related to issues causing FTT because of poor spacing, that should be considered under Garbhaja Phakka. Then early weaning, any problems which are coming out because of early weaning. Okay, in the 3 months itself, sometime you start with the external feed and stop the breast milk, or less breast milk will be given. So problems related to early weaning, because in case of Garbhaja Phakka, what happens? The mother is pregnant. In the meanwhile, first child is lactating, and when the lactation stops because of the pregnancy, now first child has to be shifted to the weaning early, or some artificial feeding, etc. That leads to so many problems. So that is called as Garbhaja Phakka. Then emotional deprivation, as I told. Okay, mother focused on the fetus which is developing in the uterus now, and she has been giving less focus to the already feeding child, because her feeding also stops. So emotional bonding also cut off, and the child will be given to the grandmother or grandfather or some others to take care. So emotionally, child will going to suffer a lot. So all emotional, inorganic causes, emotional issues, that is also included under Garbhaja Phakka. Then any of the Garbhaja refers to any of the prenatal, antenatal or perinatal causes. Prenatal, antenatal or perinatal causes may also lead to the Garbhaja Phakka, because many times the deprivation of the child may start from the Garbha itself. We know that intrauterine retardation. Okay, typical and atypical type. Typical is because of nutrition, and atypical is because of infections commonly. So now Phakka Roga can even start from the Garbha period itself. The best parameter for that is head circumference. Okay, if the head circumference is affected by at the time of the birth itself, that suggests that there is an antenatal insult. So all such causes leading to this, maybe because of congenital malformations, maybe because of these intrauterine retardations, maybe because of intrauterine nutritional problem or intrauterine infections. So that also leading to FTT, that is also considered under the heading of Garbhaja Phakka. Okay, so third one which we are dealing is Vyadija Phakka. All the disorders, Nija Vyadi Janya, all the Nija Vyadis related to the body only. Different immunological problems, different metabolic problems. So they are not from outside, isn't it? Metabolic problem, inborn errors of metabolism, metabolic problems. It is from inside body. So Nija Vyadis, immunological problems, autoimmunity, immune deficiency, immune exaggerations. So all such causes are again not related to outside. Okay, they are from the inside of the body. So such conditions are also considered as Vyadija. Then Agantuja Vyadi, outside factors, different infections, recurrent infections. Okay, maybe injuries, accidents, mechanical injuries. Okay, some of the surgeries maybe. Okay, they are considered as Agantuja Vyadis. So that may also lead to the failure to thrive. Then congenital problems, then chromosomal problems, and as well as some of the neurological problems. So this comes under the Vyadija Phakka. See, same. That means I think Ayurveda has given the criteria or platform. Accordingly, FTT has been explained. I hope so. Anyway, other factors are social factors. So what contemporary science says, social factors. Social factors are like child abuse, child neglect, orphan child, familial conflicts, etc. Ayurveda uses only one single word for that. What is that? Anataho klishyate balaha. A child who is anatha, he is more prone to develop a Phakka Roga. Okay, more prone to develop the Phakka Roga. Finish. It includes all these emotional aspects. Okay, anatha means who is not having the caretaker. No father, no mother. So father-mother care has been deprived. Okay, so he is rearing with some other support, and nobody is there to give the food in right time. There is no emotional support. There is no love, concern, empathy, sympathy, etc. Anyway, now Pradushta Grahani. One more cause is Pradushta Grahani. So what do you mean by Pradushta Grahani? There is some problem in the nutrition or nutritional utilization. Okay, so all the malnutritional disorders, malabsorption disorders, poor nutritional disorders or metabolic disorders, so they included under the Pradushta Grahani Kascha. There is a word, Pradushta Grahani Kascha. So that is included under this particular FTT or Phakka Roga. malnutrition, malabsorption, metabolic errors, hormonal errors, even hormonal problems, and GAT related any other cause. Maybe food intolerance, intolerance at times, or celiac disease at times. Okay, so they are considered under the heading of Pradushthagrahani. And contemporary science also says that malnutrition and nutrition related problems are one of the biggest cause for that. Okay, now any conditions which leads to, I told, isn't it? There is in the modern contemporary science they describe the conditions which require more caloric requirement, more caloric wastage. Such things are explained, classified FTT based on that. Similarly, Ayurveda says any conditions which require excess catabolism and more caloric requirements. So what are such conditions are mentioned? In the Phakka Roga very clearly mentioned about there is excess production of the mala and there is excess production of the mala, mutra, etc. That means waste products are more produced, dhatus are less produced. That means catabolism is taking place. For the purpose of calorie, the body is using its own body tissues. Own body proteins are utilized for the purpose of calorie. So there is no carbohydrate, there is no fat. So body has to utilize the protein only for the energy, calorie. When the proteins are considered as the building blocks of the body, that should not be utilized for the purpose of energy. When it is using, that means catabolism is more. When there is a more caloric requirement or there is shortage of calorie. Then excess dhatu mala production. Phakka Roga is called excess dhatu mala production. Dhatu mala is produced when dhatus are undergoing digestion. Dhatu mala. Then excess mutra production, excess mala production. Aharas is not digested properly. Then Singhanaka mala production. That again suggests that there is more production of this dhatu mala. Singhanaka, nasa mala. So just like the modern contemporary science, in Ayurveda also we can categorize the different causes of Phakka Roga according to this particular table. Okay, there are some nutrition related causes, there are some catabolism and anabolism related causes, there are some nutritional and digestion malabsorption related causes, and there are some social causes, there are some vyadi disorders, there are some prenatal and antenatal etc. causes, and there are some feeding related causes. So this has been calculated, tableized here, and we can understand Phakka accordingly. So when I have got Chiraja Phakka, Garbaja Phakka and Vyadisha Phakka, this should not be considered as the types of Phakka Roga, rather this should be considered as causes of Phakka Roga. Okay, these are different causes of Phakka Roga. Again, Phakka Roga we cannot say actually. Phakka is a clinical condition which can be seen in many disorders. So this is about the basic concepts of and causative factors of Phakka Roga.